The newsday continues here on One News Now. I'm Riza Diaz. The health department concedes there may be now a community transmission of the Delta variant of COVID-19 in the Philippines. This comes after the agency recorded its highest daily log of new infections yesterday. If you're giving us more details on this, we have Faith Del Mundo. She's reporting to us live from Quezon City. Faith, good afternoon. What does community transmission mean for us?
Yes, Riza, community transmission means that the Delta variant is spreading among people who may not have had any contact with another infected person. What we can expect given this development is that new COVID-19 cases will likely continue to increase in the coming days. In the Laging Handa briefing today, Health Undersecretary Maria Rosario Berjera said there may be already a community transmission of the Delta variant in the country based on samples processed by the Philippine Genome Center. But Berjera assured the public that the agency has made the necessary response even before there was no evidence of community transmission yet. The official said we can expect COVID-19 infections to continue going up in the coming days. According to the DOH, the record increase in new infections on August 20 is caused by a combination of several factors. These include breaches in the minimum public health standards and in the prevent, detect, isolate, treat, reintegrate strategies, as well as presence of highly transmissible variants. The agency added that local governments have intensified their contact tracing and active case finding, especially in high-risk areas, over the past weeks, which may have contributed to the rise in daily COVID-19 tallies. The DOH projects that if modified ECQ will be implemented beginning today until the end of September, the Philippines will have 66,000 new cases by August 31, and Metro Manila will have 269,000 active cases by September 30. Risa Berjera says lockdowns are not the only solution to the pandemic. Improved vaccination rollout, case detection, isolation of infected patients, and compliance to health standards could also slow down the spread of the virus. Riza?
Thank you for that report. That's Faith Del Mundo again reporting to us live from Quezon City. The health department has expressed concern over the recent ECQ that was implemented, which has rather led to the record high in COVID-19 cases. Speaking on the big story, Dr. Anna Ong Lim, member of the DOH Technical Advisory Group, lamented about the public mobility despite the strict lockdowns. She then called for a proper implementation of the protocols to limit the movement of individuals.
We all have to admit that this ECQ is actually not what we expected. I think I personally, I didn't expect this much movement to be happening, because what I had in mind was an ECQ that was similar to what we experienced last year, and that's simply not happening anymore.
Ong Lim, meanwhile, said these record high numbers are a reflection of what happened 2 weeks ago, noting the lag time in reporting of cases. But according to her, one of the biggest differences in this year's ECQ is that there are fewer ICU hospitalization, even with high hospital demand.
Yeah, I think one of the big differences that we're seeing with respect to the numbers is that even as there is a higher demand for hospital services, comparatively, in contrast to what we experienced in March or April, there are fewer ICU admissions, and it seems that the healthcare capacity is faring up a little bit better this time around.
Metro Manila, along with Laguna and Bataan, is now placed under modified ECQ status until the end of the month. In NCR, the unified curfew hours from 8 p.m. to 4 a.m. remain, and only those aged 18 to 65 years old are allowed to go out. Meanwhile, Outdoor exercises are again allowed from 6 a.m. to 9 a.m., while public transport remains operational at limited capacity. Religious gatherings should be online or virtual, but necrological services are limited to immediate family members. Unlike the previous MECQ, indoor and alfresco dining are prohibited. The same goes with personal care services such as beauty salons, entertainment and recreational venues, as well as indoor and outdoor sports studios such as gyms should remain closed. Now, over 1.2 million doses of Sinopharm and Sinovac COVID-19 vaccine arrived in the country earlier today. The batch includes 1 million shots from Sinovac procured by the government and 260,800 doses of jabs from Sinopharm donated by China. The National Task Force Against COVID-19 said the arrival of the new batch of vaccines will be a big help. This as the country logged its highest daily active cases on Friday at 17,231.
Ang batayan naman ng vaccine cluster ay science-based. Of course, number one yung mga rising cases sa lugar at yung daily attack rate, population density, and of course yung economic activities doon sa particular area.
It's fairly common knowledge in the medical field that the body produces antibodies after it gets an infection. But does this mean that a person infected with COVID-19 no longer needs to be vaccinated? Let's find out from the World Health Organization.
If you have COVID-19, do you still need to get vaccinated? How long should you wait before vaccination? Hello and welcome to Science in 5. I'm Vismita Gupta-Smith and these are WHO's Conversations in Science. We are talking to WHO's Chief Scientist, Dr. Soumya Swaminathan. Welcome, Soumya. Let's start with, if I have COVID-19, do I still need to get vaccinated?
After getting COVID, people do get an immune response, but this varies from person to person and it depends on whether you had a mild infection or whether you had more severe infection. And we know from many studies now that if you've had a very mild or asymptomatic infection, then many people may have very low levels of antibodies that they form. So this is why we still recommend that even if you've had COVID infection, that you should go ahead and take the vaccination when it's available to you, because the vaccine then serves as a boost to the immune system. So the immune system's already seen the infection once, it's seen the virus when you had the natural infection, and then when you receive the vaccine, it sees the antigens again, it's reminded of the antigens, the memory gets boosted, and the immune response generally gets stronger and broader and is likely to be more long-lasting.
Soumya, how long should I wait after a COVID infection to get vaccinated?
Well, you can take the vaccine actually once you've recovered from COVID. So waiting for a few weeks is recommended. You should have no symptoms at all and you should feel perfectly well when you take your vaccination. However, there are differences between countries. Some countries recommend that people wait for 3 months or 6 months till after the infection. And this is because you have natural antibodies, which will keep you protected for at least that long. And because there are shortages of vaccine supplies in many countries, they are requesting people who've had the infection to wait for 3 or 6 months. But from a scientific and a biological point of view, you can take the vaccine as soon as you fully recovered COVID. At this point of time, we are not sure of exactly the level of neutralizing antibodies that offer protection against an infection. And therefore, we do not recommend that individuals go and get antibody testing done in order to confirm whether they have immunity or not. We have to wait again for more data on what the correlate of protection is.
Soumya, what have we learned so far about immunity that is induced after an infection of COVID-19 versus immunity induced by the vaccines?
The type of immunity that's developed after natural infection varies from person to person and is very difficult to predict. Vaccines have been standardized in terms of the dose of the antigen that's being administered, and this was based on many clinical trials that have been done. And so when someone receives a vaccine, we can be fairly confident and predict the kind of immune response they will get, of course, in the majority of people. So that's the main difference between natural infection-induced immunity and vaccine-induced immunity. There are very interesting studies going on now to look at the immune response when somebody has dose of a vaccine after having had natural infection, and also when two different vaccine types are given one after the other, so the so-called mix and match approach. And scientists believe that perhaps this type of a hybrid approach might actually give us a much stronger immune response than just natural infection alone or giving a vaccination with the same vaccine alone. But these are interesting ideas, and we have to wait for the data to come from the studies. We're very confident now that all the vaccines that have received emergency use listing from WHO prevent severe disease and hospitalization due to all the existing variants of the SARS-CoV-2 virus. However, we still believe that taking the personal precautions like wearing a mask, maintaining distance, maintaining hand hygiene, and avoiding crowded and closed places, as well as the other public health and social measures that governments have put in place, are necessary because not enough people in the world are vaccinated. And so wherever you live, it is good to take those precautions in addition to being vaccinated, because that's what's going to drive infection rates in the community down.
Thank you, Soumya. That was Science in 5 today. Until next time then, stay safe, stay healthy, and stick with science.
Let us now take a quick look at today's other top stories. President Duterte has fired the National Electrification Administrator, Edgardo Masongsong, for alleged corruption. Duterte said the Presidential Anti-Corruption Commission conducted the investigation and recommended the dismissal. Duterte added that this is a proof that his administration is trying to stop corruption during his term. Taal Volcano's main crater showed vigorous upwelling that generated steam-rich plumes around 3,000 meters high earlier today. PVOC said the volcanic smog has been experienced over the Taal region this week. This as high levels of volcanic sulfur dioxide have been continually degassed from the main crater. Taal Volcano remains under alert level 2, which warns of a probable magmatic activity that may or may not lead to an eruption. And Manny Pacquiao and Eudenis Ugas both made the required weight during their weigh-in a day before their scheduled bout in Las Vegas, Nevada. Pacquiao weighed in as 146, while WBA welterweight champ Ugas tipped the scales right on the number at 147 pounds. Pacquiao is set to return to the ring after a 2-year absence as he looks to regain the WBA welterweight belt that was stripped off him. Now, for more updates, visit News 5, the Philippine Star, and Business World Online. You may also visit our website, onenews.ph, for more in-depth analysis. You can also catch One News on Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. I'm Riza Diaz. Mask on, wash hands, and stay safe, Philippines. We are One News.